Now, after the benign tumors, let's talk about the malignant tumors of the external auditory canal. And the malignant tumors, first one is the squamous cell carcinoma. This is the squamous cell carcinoma. Squamous cell carcinoma originate from the squamous cell, which are thin, flat cells present on the surface. So this is the picture of the squamous cell carcinoma present in the external auditory canal. It can lead to fluid discharge, which can be bloody, or it can be mucopurulent, purulent, or it is associated with severe earache is present. Arise from meatus or secondary extension from middle ear carcinoma. So it can be the primary tumor of the meatus, external auditory canal, or it can be an extension from the middle ear squamous cell carcinoma. But one thing, it is associated with pain, earache, and then there is discharges with this squamous cell carcinoma, and discharge can be bloody discharge, mucopurulent, or purulent discharge. That's the clinical presentation. You can see it's reddish in appearance, squamous cell carcinoma. Treatment is wide surgical excision as a whole, post-operative radiotherapy. So it is excised or removed as a whole, and then after the surgery, radiation is applied. Next, malignant tumor of the, or malignant carcinoma of the external auditory canal is basal cell adenocarcinoma. It rarely arises from the meatus. The clinical presentation is this. Here you can see that's the basal cell adenocarcinoma. So it's not very common malignant tumor that arises from the auditory meatus. Treatment is surgical excision if it do occur. Some other malignant tumors of the external auditory canal, we have malignant ceruminoma. Here you can see that's the malignant ceruminoma of the external auditory canal. Then we have malignant melanoma. Melanomas are usually brownish or blackish in color. So here you can see that's the malignant melanoma, tumors that arise from the melanin producing cells. So this is just the summary of all the malignant tumors of the external auditory canal. We have basal cell adenocarcinoma, which is a rare type of tumor. Then we have malignant ceruminoma, melanoma, and squamous cell carcinoma, which can be primary from the external auditory canal, or it can be an extension from the middle ear. So these are all the malignant tumors of the external auditory canal. So that was all about our topic, which was the tumors of the external ear, in which we talked in detail about the benign and malignant tumors of the auricle and the external auditory canal. So that's all for our today's topic. Keep watching sqadia.com.